Welcome back, my people. We are still discussing about ear infections, or what we call otitis media. Let me start by appreciating you people for your time, the support you have given me as a family, the subscriptions, the likes, the comments, and the encouragements. So, for those who have not subscribed, let's subscribe, like, and share our videos. If you have a topic you are concerned with or you want us to discuss, you can put it in the comment section and we will be able to handle it. So keep the support on. Let's get back to our point of discussion, whereby we are talking about otitis media or ear infection. And in this video, we'll be talking about the complications of ear infection or otitis media, or what will happen if a ear infection, also called otitis media, is not promptly treated or is not diagnosed and treated on time. So, ear infections don't cause long-term complications, but they don't cause long-term complications. But ear infections that happen again and again or repeatedly lead to serious complications like 1. Impaired hearing. Impaired hearing simply means difficulties in hearing. So, in impaired hearing, mild hearing loss that comes and goes is fairly common, and ear is fairly common with ear infections, but gets better when infections clears. Number 2, we have speech or developmental delays. Speech or developmental delays. Here, if hearing is temporarily or permanently impaired in infants and toddlers, they may experience delays in speech, social and developmental skills. Number 3, we have spread of infection. Here, untreated infections or infections that don't respond well to treatment can spread to nearby tissues. Infection of the mastoid and the bony protrusion behind the ear is called mastoiditis. I hope you get that. This infection, the mastoiditis, this infection can result in damage to the bone and formation of pus-filled cysts. A cyst is just an inflammation which might be filled with pus or fluid. I hope we are together, guys. So, rarely do serious middle ear infection spread. This means middle ear infections doesn't spread so easily. So, rarely does serious middle ear infection spread to other tissues in the skull, including the brain or membranes surrounding the brain. So, if it does spread and reaches the brain and affects the membrane covering the brain, or the meninges, it becomes meningitis. And meningitis is an infection or whereby there is an inflammation of the meninges or the membrane surrounding the brain. So, the next point or the next complication which can occur as a result of untreated ear infection or otitis media is what we call tearing of the eardrum. Tearing of the eardrum. Most eardrum tears heal within 72 hours. In some cases, surgical repair might be needed instead. So this means this condition can sometimes become worse and problematic. So let's talk about prevention, how you can prevent this kind of infection or ear infection or otitis media. So the following may reduce the risk of ear infection. So it can be prevented 100%, but the risk can be prevented. Number one, how you can prevent the risk of ear infection. Number one, prevent common colds. Prevent common colds and other illness. So teach your child to wash hands thoroughly and not to share drinking utensils. Teach your child how to wash hands thoroughly and not to share drinking utensils. This can spread common colds and flu from one child to another. So child care group setting with fewer children can help. So if you have to take your child into a child care group, fewer children can help or prevent spread of this kind of diseases like flu. Another point, teach children to cough or sneeze in between their elbows. That's another point, limit time your child spends in group child care. The lesser the time, the better. Number two, avoid second-hand smoke. Avoid second-hand smoke. This means you make sure no one smokes in your home. If you are away from home, stay in smoke-free environment. Stay in smoke-free environments. Number three, breastfeed your baby. Breastfeed your baby or baby fed for at least, breastfeed your baby for at least 6 months, as breast milk contain antibodies that offer protection against ear infections. So if you breastfeed your child for 6 months, the breast milk provides antibodies that offer the child with protection against ear infections. Next point, if you breastfeed, hold your baby in upright position and avoid propping the bottle in your baby's mouth while he or she is lying down. This means you hold the baby in upright position, avoid propping the feeding bottle while your child is lying down, as this can predispose the child to having a ear infection. Next point, talk to your doctor about vaccinations. Talk to your doctor about vaccinations. This means ask your doctor what vaccination are appropriate for your child. For example, seasonal flu vaccines and the pneumococcal vaccines. This marks the end of our topic today. This marks the end of ear infection or otitis media. Thank you guys for your support. Thank you for being with me. Thank you for the likes. Thank you for the subscriptions. And I hope you will continue supporting this channel and we can see it's growing to greater heights. Let's continue keeping the support on, and let's continue being together as one family. Have a good day.